Good good afternoon, everybody. This is Dr. Ashish. I'm just testing out something. So please let me know that you can see me and also where can you see me? Um, so this is I should be live on all the platforms. So I'm not sure if you are able to catch me on any of the platforms. So would be great to see and great to hear from you if you can see me live. Yes. So Instagram is working. Sorry, LinkedIn is working and Facebook is also working and YouTube should be working as well. It's just Instagram that I'm not sure if you're able to see me on Instagram. So thank you for whoever is listening. Please let me know, and it'll be great to connect with. And I'm just testing out so that I can connect with everyone on all the platforms at the same time. It will be easier that way because time is getting tight to go live on every platform separately. My name is Dr. Ashish, as many of you know, and I specialize in natural fertility and rejuvenation. So, natural medicine, natural way of improving your health and well being, natural way of enhancing your health for fertility or for any other reason. If you are somebody who is trying to get pregnant right now and going through IVF or any other method to, or just even naturally, then what is it that you are doing naturally? Are you taking any natural method in terms of not just only having sex at the right time? That's one step. And then if that is not working, then what is the next step that you're doing naturally? And how are you enhancing your body and your mind to help you with that? So that is where we support our patients, our clients, to help them. And I also support couples as well. So it's not just only women, but couples, especially where there is men's fertility issues as well. We support them as well. And rejuvenation is how can you rejuvenate yourself from within, internally? What are you doing from inside out? Whatever you're doing from outside in is fine. And generally, people think of in rejuvenation as taking supplements. I'm taking supplements, antioxidants, and taking all those pills. uh, you know so that is one method. Yes, you can take supplements, and supplement should only be supplementing. Supplement is not the main thing that you should be having. It's not food. And in addition, what else can you do? All the supplements that you're taking for your rejuvenation, or especially antioxidants that so many women are also taking for fertility as well as for other reasons, if your gut is not healthy, if you're constipated, if you have got inflammatory gut, or if you have got something indigestion or something else going on, acid reflux, which means that there is inflammation in your gut, if that is happening, that doesn't matter how many supplements you take, they're going to not give you the kind of nutrition that you need. So it is not just only supplements that is required, your internal health, your cellular health. So that's what we do with rejuvenation, with herbal medicines, with therapies that we do in the clinic. And yeah, so feel free to let me know if you can hear me. Otherwise, I'll be live for a few more minutes just to check it out because I know it is working, and that is good to know that it is. I'm able to go live for everyone. And also from tomorrow, the reason I'm doing this today, just checking it out, is because from tomorrow, every Friday, 12 till 1, I'm going to do a live show on all the platforms. So going live on all the platforms with a guest. So rather than me talking to professionals, practitioners, by myself, or on a Zoom, we might as well do it in front of other people so that everybody can hear this, everybody can get that information, and we can have a great chat. And I want to raise more awareness about natural medicine, about fertility, natural fertility support that we can do. So that is why it is every Friday, 12 till 1. Certain Fridays, of course, if in case I have emergency or I can't do it, then it won't be there. Otherwise, we are booking in, and tomorrow we have first guest. This is a doctor in Southwest London, a GP, and he has got special interest in diabetes and ADHD. So that is what we're going to talk about. I'm going to talk about natural medicine, holistic medicine. How can we then, how can GPs become more aware of holistic medicine? If they are interested in that, how can they offer better something more to their patients, especially patients who have got chronic health conditions where all then rest left to do is to just keep giving them medications? How can we then support their health with natural ways? So that's why I'm very keen to have this dialogue, and it will be interesting. So I will be live tomorrow 12 o'clock, and you will be able to hear me and Dr. Lavan Bhaskaran. So both of us will be live tomorrow 12 till 1. If you are a practitioner, a doctor, consultant, GP, private GP, a nurse, a doula, or natural health practitioner, herbalist, I'm already connected with so many practitioners, which is great, and connecting with even more so that we can have these great discussions and others can listen to it also. So that is what I'm going to do tomorrow. And if you are one of the practitioners, reach out. We can have a consultation as well. It is not exclusive to anyone, but practitioners mainly. And even if you are a coach and you do some kind of natural medicine, yoga, or perhaps you do herbs, or maybe something else you're offering to your clients, then we can also talk as well. So, live show, Dr. Ashish on air 12 till 1 every Friday is happening from tomorrow. We're going to start from tomorrow and keep going. At least I've got dates until end of May. So what else is, every week I talk about one particular topic related to fertility health. How can I support your fertility health? Without your health, especially a woman's health, whatever else you're using is not going to help if your general health is not good. So, and what you don't have at the time when you're trying to conceive, what you don't have is the time, because time gets spent out really, really fast because there is so much waiting time, especially on the NHS. I think NHS probably does not understand the sensitivity of women's fertility window. And sometimes you find that it is years before anybody is, by the time you even get to the point of IVF, or get to the point of any even test, sometimes it's about a year or 2 years. And that is long time for fertility patients. And there are discussions, there are other small groups who are liaising with NHS to fasten it, to make it faster for those women to go to have recommendations or from the GPs a bit much more quicker. But it is still, we are looking at weeks and weeks and months of waiting time. So what can you do meanwhile? Even if you're doing main thing or a lot of things on the NHS, there is something that you can do privately, something that you can do, herbal medicine consultation. You can do natural therapies to improve your health, and for both the partners. And that is what I do from my clinic in Harley Street, and we support women and men. And yeah, so all of this, and reach out if anybody who's looking to connect, and also if you're a patient and looking for natural medicine, natural health support, then reach out as well. And we are also doing an event on 23rd of March. We are going to have wonderful speakers at the event. This is all natural and health and well-being event. So also, if you're a patient and you want to talk about your health scenario, you want to talk about your journey, you can also come and join us. So let me know, and we'll be happy to have you at the event. 23rd of March, it is happening in High Street, Kensington Holiday Inn. So we will be there 23rd of March most of the day. And if you are a practitioner, or if you're a holistic practitioner and you provide some kind of health and well-being products, you can also you can exhibit as well. So we're going to have just very selective few stalls, maybe 4 or maximum 6 stalls, so you can also exhibit as well. Thank you. I think this is working. Not sure if it worked on LinkedIn, worked on Instagram, but it worked everywhere else. So thank you for listening, anybody who did listen, and bye bye.